Thank you, Presiding Officer. Can I take this opportunity to welcome the election of a new UK Labour government and to congratulate Keir Starmer on becoming Prime Minister? I'm sure the whole chamber will want to congratulate all of Scotland's MPs, new or returning, regardless of party, who have been elected to represent and deliver for the people of Scotland. Yesterday, the First Minister outlined his programme for government, a statement with no vision, no strategy and no plan. And nowhere was that more glaring than for our NHS. On their watch, over 864,000 Scots are on an NHS waiting list. That is 1 in 6 people across the country. Now, the previous two First Ministers promised a catch-up plan and things got worse. But this First Minister didn't even mention it. And unbelievably, despite growing demand and lengthening waiting lists, our NHS is performing 50,000 fewer operations a year than before the pandemic. So by what date does John Swinney expect patients to receive the standard of care they deserve and that they are legally entitled to?
First Minister.
First of all, Presiding Officer, let me echo the words of welcome from Anas Sarwar to Keir Starmer as the new Prime Minister. The Prime Minister telephoned me the day of his election as Prime Minister and came to see me on the Sunday after the election, and I very much welcome the efforts the Prime Minister has made to create a better relationship between the Scottish Government and the United Kingdom Government. Frankly, couldn't have been any worse than it was before, but I do acknowledge that effort, and there have been a series of other engagements, and on some of the really significant issues that we are wrestling with, both governments, there has been deep engagement on some of those questions, which I welcome, and that will be, and the Scottish Government will engage in all of that activity. We face significant challenges in the National Health Service, as Mr Sarwar knows. The programme for government set out a range of different interventions. This is where Mr Sarwar was incorrect in his question. The programme for government set out a range of interventions that we are making to ensure that we reduce waiting times within the National Health Service, that we expand the capacity for undertaking treatment, and that we improve the performance in a number of key areas, particularly diagnostic information. I put on the record yesterday about cancer diagnosis, which is significant in improving the outcomes for individuals in Scotland. We are working very hard to overcome the waiting lists that have been created as a consequence of COVID, and the Health Service is being resourced to enable it to do so.
Anas Sarwar.
I thank the First Minister for that answer, but I don't think he understands that waiting lists are actually getting longer. And let's take a single example, Mark Rogers. A former footballer, Mark has had prostate problems for years. In April, he was told he needs urgent surgery, and he's been using a catheter for 5 months. It was only meant to be for weeks. He is in unbearable pain and has been having suicidal thoughts. And despite being told his treatment is urgent, he's been told he could have to wait for over another year. He said, "I'm in constant threat of life-threatening side effects and potential organ damage. I haven't acted on my suicidal thoughts, but I'm terrified where depression is leading me." Lothian's Health Board has confirmed that they will not meet the treatment time guarantee for Mark and apologised. But saying sorry doesn't cut waiting lists. So when will this government stop failing Mark and the thousands of patients like him?
First Minister.
First of all, I'm sorry about the detail that Mr Sarwar puts on the record on behalf of Mark Rogers, and if he wishes to pass particular details to me, I will explore the case and determine if there is anything more that can be done to support the treatment for Mr Rogers. I think it's important to put on record the fact that we are still dealing with the aftermath of the COVID pandemic. We are resourcing the health service to a greater degree than would be possible had we just simply replicated the financial settlement from the United Kingdom Government. That's come about as a consequence of the decisions that the Government in Scotland has taken about taxation, where we've asked those on higher incomes to contribute slightly more in taxation, and we have invested a large proportion of that in the National Health Service. So I can give Mr Sarwar the assurance that the Government will continue to invest in the National Health Service to expand capacity. We obviously are trying to deliver the treatment that individuals require as timorously as is possible, and of course there are many, many examples of that happening, but I accept, and Mr Sarwar has put this case on the record, that there will be cases where that is not so, and I will endeavour to do all that I can to try to resolve those issues on behalf of Mr Rogers and patients like him.
Anas Sarwar.
The frustrating thing is that week after week the First Minister says sorry, and week after week those sorries still do not cut waiting lists, and people still are failed by this government. And Mark is just one example of thousands of examples right across our NHS which is in crisis. And the statistics are so bad, and the stories of patient failure so regular, that it actually feels like the government have become desensitised to this crisis. 37,000 Scots on a waiting list for an operation right now have already waited for over a year. Right now, there are almost 5,000 children waiting for mental health care. Thousands of families have already been forced to empty their savings or borrow money to pay for private care, all while the NHS carries out 50,000 fewer operations a year. So can't the First Minister see that behind every one of these numbers is a patient in pain, an anxious family and a workforce at breaking point, and that we need a government in Scotland that is serious about saving our NHS so it's there for people when they need it?
First Minister.
Can I reassure Mr Sarwar that there is nobody in government, certainly not me and certainly not the Health Secretary, who is desensitised to the scale of the challenge, and we are very much focused on improving the performance of the National Health Service. Mr Sarwar talked about one of the examples that he cited was about children's access to mental health services, and there is a stronger performance being delivered there, and I welcome that. That's come about because of the commitment and the dedication of staff and the ability to expand capacity to do that. We are taking steps on to ensure that we improve capacity within the health service. On cancer, for example, there is strong performance in terms of the median waits for individuals receiving treatment. Obviously, in that, there will be people that wait longer. I accept that. But we are trying to reduce those waiting times as quickly as we possibly can do. And that will remain the focus of policy making and decision making within the Scottish Government, and it commands the full attention of the Health Secretary and me as part of that process.